Phobias. Introduction. Which one of the following describes a phobia? Choose one of the following options. 1. A type of anxiety disorder. 2. A fear of something that poses little or no actual danger. 3. Something that causes long-lasting fear. 4. All of the above. Correct. Phobias are an anxiety disorder that cause strong, irrational, and long-lasting fear of something that poses little or no actual danger. People with phobias are unaware of how unreasonable their fears are. Select true or false. Correct. People with phobias often feel powerless to control their fears even though they know that their fears are unreasonable. Does having a risk factor for phobias mean that you will develop a phobia? Select yes or no. Correct. Having a risk factor does not mean you will develop a phobia. What is the goal of therapy in the treatment of phobias? Choose one of the following options. 1. Reduce your anxiety. 2. Better manage your reactions. 3. Control your thoughts and feelings. 4. All of the above. Correct. These are all goals of therapy to treat phobias. Thank you for using Explain.